Hello, and welcome to our special episode of The Doctors Is In. Today, we're shining a light on a rare disease in honor of World Amyloidosis Day. I'm your host, Hala Kirshah, Institute Administrator here at the Cleveland Clinic, Abu Dhabi. And I'm thrilled to have Dr. Firas Al Badarin with us. Dr. Firas is a cardiologist at the Cleveland Clinic, Abu Dhabi, who is an expert on cardiac amyloidosis. Welcome, Dr. Firas.
Thank you so much, Hala, for having me, and thank you for this opportunity to shed more light about something near and dear to my heart, like cardiac amyloidosis.
Absolutely. Let's dive right in. What is World Amyloidosis Day all about, and why do we have a day dedicated to this disease?
Thank you, Hala. That's such a fantastic question. It is a worldwide initiative that came about to raise awareness about amyloidosis, which is an underdiagnosed and under-recognized disease entity that affects a lot of people in the world. And the idea behind this is to raise awareness, increase recognition, and to help healthcare providers think more about this disease process and highlight that it is much more prevalent than what we think.
Great. So let's step back and understand what exactly is amyloidosis. I know it's not a common term, so how would you explain that in simple terms to a patient?
That's also one of the things I oftentimes struggle with when I try to explain the disease to my patients. So let's try to simplify it. Amyloidosis is a pathological term that was coined more than 100 years ago. And what it really means, it means abnormal protein deposition in different organs of the body. Basically, proteins deposit where they do not belong. At the basis, amyloidosis is a protein misfolding disorder. What that means in simple words, proteins are supposed to exist in a certain three-dimensional structure, but in patients who suffer from amyloidosis, this structure is lost for a variety of reasons. And as a result, these proteins become misshaped, become abnormal, they get sticky to each other, and they form these sticky molecules that deposit in all organs, and that leads to organ dysfunction. For example, they do not belong to the heart. So if these sticky proteins deposit in the heart, they render the heart muscle stiff, unable to relax, unable to perform its function properly. If they deposit in the kidneys lose a part of their function, and so on and so forth. So the manifestations of amyloidosis really depend on which organ is predominantly affected.
So that makes sense. So it's basically protein going rogue and then clogging things up. And just to make sure that can happen in any organ?
That's exactly right. It depends. There are a variety of proteins that can go rogue, as you described, or can become misshapen, and that depends on the underlying process. So let's simplify it even further. One of the most common entities that we deal with in cardiology is ATTR, and that is short for transthyretin amyloidosis. So transthyretin is a naturally occurring protein in our bodies. It's produced by the liver, it transports thyroid hormones, and so on. So that happens when the protein is in the normal shape. If the protein loses its normal shape due to aging or due to a mutation in that protein, the protein becomes unable to perform that function, and it starts to disintegrate, form these amyloid fibrils, and these fibrils deposit in the heart and affect the heart function. It also deposits in certain parts of the body, like the carpal tunnel, like the spinal cord, and that causes symptoms as well. The other common type, like AL amyloidosis, and it stands for light chain amyloidosis. We all have immunoglobulins that help us fight infections. In patients who have AL, there is excessive production of that protein. And because there is excessive production, it starts to disintegrate and starts to form the amyloid fibrils. And in this case, it affects the heart, it affects the kidneys, and can also affect the nerve function.
Great. So let's talk about cardiac amyloidosis. What happens when it affects the heart, and when should a patient seek medical advice?
That's what pertains to us, right,
Yes.
as cardiologists.
And when should they come see you?
Exactly. So I think there are two important aspects to this question. Number one is when we think about cardiac amyloidosis, how does it affect the heart? As I said, when the proteins deposit in the heart, it leaves the heart muscle less pliable, loses its ability to relax. So this causes some form of heart failure. Oh. And how do patients manifest? They have fatigue. They have shortness of breath with activities that they used to do without problems. They have fluid buildup in their bodies, so they will notice swelling in their legs, shortness of breath, and so on and so forth. And as I said also, it doesn't deposit only in the ventricle, in the contracting chamber of the heart. It also deposits in the atrium, which is responsible for electricity generation and for sometimes for arrhythmias. So therefore, these patients experience arrhythmias, heart blocks, or electrical perturbations that affect the function of their heart. In addition, these patients may also experience aortic stenosis. And the relationship between aortic stenosis and cardiac amyloidosis is really unclear and difficult to explain. Suffice it to say that patients who have aortic stenosis tend to have a higher likelihood of having ATTR cardiomyopathy. Whether one disease causes the other is still unclear. The second important aspect to this question is, when should we suspect that they have cardiac amyloidosis? As I told you, this is an under-recognized disease. Providers tend a lot of times not to think about it. And think about this statistic. It takes anywhere between 3.5 and 4 years wow. between the onset of symptoms and a physician making the correct diagnosis. That's a lot of time that goes between onset of symptoms and diagnosis. And this reason is simply we don't think about it. So my advice to my colleagues who see these patients, if you see a patient with heart failure, think about cardiac amyloidosis, especially if they have increased wall thickness. Patients who have heart failure with increased wall thickness, or as we refer to it as LVH, deserve a moment to think about, does this patient have cardiac amyloidosis or not? Chances are most of them don't have cardiac amyloidosis, but at least giving them that chance to think about the disease and rule it out and exclude it is actually can help them arrive at a diagnosis sooner and improve their outcomes.
Wow, so 4 years to diagnose. It seems like it's very difficult because things could be confusing. But I want to follow up on what would change in the treatment plan if it is not just heart failure, but also cardiac amyloidosis?
Thank you, Hala. This is such a crucial question because nowadays, cardiac amyloidosis is a treatable condition. Okay. Back in the day, we did not have therapeutic options for this disease. So making the diagnosis early or late didn't really matter to patients. But nowadays, it makes a huge difference. And as a follow-up, as you said, it presents as heart failure. But what is unique about heart failure caused by cardiac amyloidosis versus other disease entities? It's very simple. You want to suspect it, you want to think about it if the patient has increase in the wall thickness. Remember the basics, the protein deposits in the heart muscle, so that will cause it to become stiff yeah. and grow in thickness. So anytime you see a patient with heart failure and thick wall, think amyloidosis.
Okay, so that leads to an important question. How common is this disease? And can you give us an idea on the number of patients suffering worldwide and even bring it closer to home in the UAE and the Middle East?
This is very important. Historically, amyloidosis has been thought of, as I told you, as a rare disease. It turns out that it is not as rare as we thought it
it's
once
just misdiagnosed.
was. It is underdiagnosed.
Okay.
So to complicate things further, if a disease is not diagnosed, you can't really get a true prevalence of that disease because your patients are just walking around with an undiagnosed condition. But we have some estimates. In the United States and North America, it's estimated that about 300 to 400,000 patients have ATTR cardiomyopathy, which is the form that affects the heart. How about closer to the Middle East, closer to home in the Middle East? We really don't have exact statistics, but we can use some estimates. It is estimated that 11% of patients who are admitted with heart failure actually turn out to have cardiac amyloidosis. So if you do some simple back of the envelope calculation, we should have around 6,000 patients with cardiac amyloidosis in the UAE. Have I seen 6,000 patients in the
I don't
UAE?
think so.
Absolutely not. So that again brings us to the point that this is an under-recognized cause of heart failure, and we really need initiatives such as the World Amyloidosis Day to bring this up to the forefront and think about it, suspect it, and diagnose it, and refer it to the proper centers that are comfortable with dealing with this condition.
That's very helpful. Thank you for explaining.
Of course.
I just want to make sure we cover this. How do you diagnose cardiac amyloidosis?
The first most important step is to think amyloid. If you don't think amyloid, you're not going to diagnose it.
Okay.
So once you think amyloidosis, it is very important to understand that this is such a systemic disease. In other words, it doesn't only affect the heart, but it affects different organ system, affects the kidneys, the nerves, the musculoskeletal system. So to think amyloid, you really have to think outside the heart, outside the box. And bring these clues and hints together to be able to make the diagnosis. So step number one is suspicion. Step number two, once you suspect the disease, it will come to your mind more often, more frequently, and you're more likely to make the diagnosis. Confirming the diagnosis is very simple. In this day and age, we have non-invasive techniques that enable us to confirm this diagnosis. Historically, amyloid was diagnosed with cardiac biopsy. Imagine you need to take a tissue from the heart, a sample from the heart, to make the diagnosis. In 2025, that is no longer the case. We can diagnose cardiac amyloidosis with a non-invasive test, which is basically an imaging modality that allows us to identify amyloid deposition in the heart. It's called cardiac amyloidosis radionuclide imaging, which is an isotope-based technique that allows us to detect involvement of the heart. And in this regard, I want to emphasize that once you make sure there is cardiac involvement or there is amyloid deposition in the heart, it is extremely important and extremely critical to make sure these patients do not have AL amyloidosis, which is a time-sensitive diagnosis that requires really collaboration and involvement of our colleagues in hematology, because that's a time-sensitive disease. The sooner we make the diagnosis, the sooner we initiate treatment, the better the overall outcomes will be.
That's really eye-opening, Dr. Firas. We've talked about the disease and why do we need awareness. I just want to hear from you more about the initiatives that are happening here in the UAE and how we're spreading the word.
That's another important question. We're very fortunate that we have been involved, us and others, have been involved in multiple initiatives at the local and at the regional levels. And at the center of all of these initiatives is raising awareness. Remember, by the time we see patients in the Cardiac Amyloidosis Center here in Cleveland Clinic, Abu Dhabi, a couple of years have passed in the best case scenario, and the patients are struggling, they don't have a diagnosis, their families are anxious, and so on. And most importantly, treatment has not been initiated, which leads to worse outcomes. So it's very critical that we raise awareness, not necessarily at the center here in Cleveland Clinic, Abu Dhabi, but rather at the periphery where these patients start to be seen. So I always emphasize to my primary care colleagues, general and internal medicine colleagues, if you see a heart failure patient, they are very common. If you see a heart failure patient with left ventricular hypertrophy or increased wall thickness, that is a red flag that should not be ignored. Think about cardiac amyloidosis. At least give them the opportunity to think about this disease. Refer this patient, and we can continue the workup. There are other red flags. If you think about cardiac amyloidosis and you think about heart failure, think about carpal tunnel syndrome, think about aortic stenosis, all of these are red flags. How do we get primary care providers, how do we get general practitioners to think about these? We need education campaigns. The World Amyloidosis Day is one opportunity to talk and discuss cardiac amyloidosis worldwide. More locally, we've engaged in education campaigns, in-person activities, online activities. For instance, Cleveland Clinic Abu Dhabi hosted the Gulf First Cardiac Amyloidosis Summit in 2021. This was an online activity with more than 1,000 attendees from around the world. We were joined by the world experts in cardiac amyloidosis, and the activity was well received. We're also engaged in the Gulf Amyloidosis Club. This is more of what's up and coming, what is new in the space of amyloidosis. We discuss updates, and again, we involve local, regional, and worldwide experts. All of these are online activities. There are also publications. We've engaged in the Cardiac Amyloidosis Awareness Survey, which was a survey involving physicians in the region to assess, number one, their level of expertise and knowledge about cardiac amyloidosis, and number two, we really wanted them to tell us what do they need to know more about cardiac amyloidosis. And the results were eye-opening. They told us about the need for hands-on activities, for in-person events, and we are using this feedback and acting on it in the next few months.
That's great to hear. It sounds like the momentum is building here in the UAE. Okay, so now let's discuss very important questions. Are there treatment options? What are the treatment options for this condition? Is there a cure? Any effective options out there?
That's another crucial question, Hala. Thank you for asking it. Let me break it down into two parts. What are the available treatment options? Many. We are very fortunate in this day and age that we have multiple treatment options. If we are dealing with transthyretin amyloidosis, the most common type that affects the heart, there are multiple treatment options available, approved by regulatory authorities, and available here in the United Arab Emirates. Furthermore, there are additional treatment options that are more exciting that are coming down the pipeline, and the coming few years are really promising for transthyretin amyloidosis. If you think about AL amyloidosis, which is another common type, there are also treatment options, and basically they have to deal with suppressing the production of the light chain from the bone marrow. Most of that treatment is directed by our colleagues in hematology, whereas treatment of transthyretin patients is more directed by cardiologists. In either situation, there is important attention. There needs to be attention to the management of heart failure, volume overload, and fluid retention, because that's what really gets these patients. The other part of your question is there a cure? Not yet, okay. But there are very promising gene editing therapies that can really eliminate the underlying mutation, which particularly works in what we call the variant TTR disease, the hereditary side of TTR disease, where you can receive certain technology that will eliminate and edit out that mutant gene and basically cure the disease. Is it ready? No, it's not ready. It is in under clinical investigation, but the results are very promising.
Okay, so it sounds like it can be managed. There isn't a cure that's fully ready yet, but is there anything that a patient or a person can do to prevent it?
The most important thing is early diagnosis and early detection. I'm not sure if there is, we understand enough about the disease process to be able to prevent it, but if a patient is destined to have amyloidosis, most important aspect of their care is early diagnosis, which means early treatment.
So right back to the awareness theme. You said if you're never diagnosed, you'll never get treated.
That's exactly
Simple.
Right.
How can our listeners be involved and show support?
Number one, simple thing. You can wear orange in recognition of the World Amyloidosis Day. That's something easy enough to do. Spread the word. If you are somebody who has amyloidosis or has a family member who has amyloidosis, spread the word about this disease and mention how you were diagnosed or how your family member was diagnosed, and that may be enough. Raise enough red flag and enough suspicion with people around you, and they can bring it up to their physician. For physician, it is very important to be engaged in these awareness campaigns. Join a webinar, join an in-person event that discusses cardiac amyloidosis, and I assure you there are no shortage of such activities. If you are a healthcare provider and you have a patient and you think about cardiac amyloidosis, always think about these patients need multidisciplinary care. These patients are better served in a tertiary care setting. We in Cleveland Clinic Abu Dhabi have a multidisciplinary team that takes care of these patients across the entire gamut. So always keep in mind that this is we are available, we are happy to help. And the most important, last thing and most important thing is think amyloidosis. If you don't think about it, you're not going to diagnose it. And if you don't diagnose it, the patient's not going to get treated.
Think amyloidosis.
Always think amyloidosis.
Okay. That's fantastic. Very actionable step. Throw on something orange and take a minute to share a fact or two about amyloidosis. Dr. Firas, thank you so much for this enlightening conversation. I think our listeners now have a much better understanding of this disease. And to our audience, thank you for tuning in. If you learned something today, please share this episode with others. Let's help spread the word about amyloidosis.